Hi everybody, my name is Heidi Galar Sarudo and today's topic is null mutation in hormone sensitive lipase gene and risk of type 2 diabetes. So definition. Genes encoding proteins that regulate energy homeostasis through lipolysis are thus likely to play an important role in determining susceptibility to metabolic disorders.
It's Dan Solomon with the BloodSugarBlueprint.com coming at you with another session of our Diabetes Information Series. Today we're going to talk about risk factors for type 2 diabetes. No one knows exactly what is the cause of diabetes, but what we do know some things called risk factors, which actually increase your chance of having type 2 diabetes. So the risk factors for type 2 diabetes include being over the age of 45, being overweight with a BMI greater than 25. There's various websites on the internet that you can go to get this calculated for you, but basically it takes into consideration your height and your weight for that height. And having a family history of diabetes. If your mom, dad, grandparents had diabetes, you have basically double the risk of developing it yourself. Being African American or Hispanic, you're likely to develop it too. Being sedentary, not working out on a regular basis, being active. And for women, if you've had diabetes during your pregnancy or gave birth to a baby that weighed greater than 9 pounds, you have an increased risk of developing it after the pregnancy or years down the road. Some women actually, if they develop diabetes during the pregnancy, that actually stays with them post-pregnancy for some women. Having a high blood pressure, which is considered 140/90 or higher, increases your chance. Having an HDL, good cholesterol level, lower than 35 milligrams per deciliter. And of course you would have to go to your doctor to get that tested. And having triglycerides, which are basically blood fat level of 250 milligrams per deciliter or more, and again you would have to go to your family physician to get that tested. Now, for more great information on type 2 diabetes and how you can reverse it.
Application in medicine. This study wants to determine the effects of the deletion of unmetabolic traits. Pros and cons. Pros. These findings indicate that physiological significance of HSL in adipocyte function and the regulation of systemic lipid and glucose homeostasis and underscore the severe metabolic consequences of impaired lipolysis. And on the other hand, the cons are carriers of the mutation has dyslipidemia, hepatic steatosis, systemic insulin resistance, and diabetes. So the disease. If you have type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make up for it, but over time, it isn't able to keep up and can't make enough insulin and keep your body and glucose at normal levels. So, what happens in our body? This is a question some of the sick people ask them. So let's see this video to know more about it.
Type 2 diabetes occurs when your pancreas does not produce enough insulin, and your body is resistant to the insulin that is produced. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. During the digestion process, the carbohydrates from your food are broken down into glucose. Glucose is absorbed into the bloodstream where it is carried to cells throughout your body. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 2 diabetes, your insulin receptors are less sensitive. Though your pancreas continues to produce some insulin, it is not enough to meet your body's needs. When your body's cells are less responsive to insulin, it is more difficult for glucose to enter the cells and raise your blood glucose level. As a person with type 2 diabetes, it is important to monitor and maintain healthy blood glucose levels. Over a long period of time, high blood glucose levels can lead to serious health complications such as heart attack and stroke, blindness, kidney failure, and nerve damage. By getting daily physical activity, eating a healthy diet, and taking your prescribed medication, you will decrease your chances of developing complications from diabetes.
So, another question. Does diabetes can be prevented? Let's learn about it.
Hi, I'm Ann Peterson. Welcome to Health Perspective by Blue KC, featuring advice from experts on a variety of health topics. It's the place where you'll get the direction you need to make good health choices. Today, Dr. Brad Silver is here to talk with us about diabetes and how type 2 diabetes can be prevented by good health choices. Dr. Silver is an endocrinologist who specializes in diabetes. He's been in practice for 30 years at Shawnee Mission Medical Center. Thanks for joining us today, Dr. Silver. The statistics are astounding. More than 20 million Americans having type 2 diabetes and 57 million more on the verge of developing it. But of course, the good news is that type 2 diabetes can be prevented. First, tell us what is diabetes and describe for us the different forms that you can have.
Type 1 diabetes is the easiest type to understand. In type 1 diabetes, individuals do not make enough insulin, a chemical in our pancreas. And we need insulin to control our blood sugar. So type 1 diabetes is just a condition in which the blood sugar is high because there's not enough insulin. And that's pretty straightforward. Type 2 is much more complicated because in type 2 diabetes, individuals do not make enough insulin. In addition to that, they do not use it right. That's a condition we call insulin resistance. So they do not utilize their insulin properly, in addition to not making enough of it.
So when should you be screened for diabetes?
The American Diabetes Association recommends that everybody above the age of 40 be screened for diabetes. But we know that there are individuals who are at much higher risk and should start their screening probably about the age of 20. Those will include people who are obese, people with family history, and women who have some type of menstrual problem or some pregnancy-related problems.
Let's talk about some of the symptoms of diabetes. Are they the same for type 1 and type 2?
Now, type 1 is much more explosive. We think about type 1 as being a condition that comes on fairly quickly, and people with type 1 typically get the symptoms we always think about with diabetes: excessive thirst, excessive urination, blurred vision, weight loss. These are the standard symptoms that we see in type 1 diabetes. Type 2 is much more sneaky, and probably 70% of all cases of type 2 are diagnosed in an asymptomatic person. Person that goes to the doctor and has blood tests. Person that goes to the hospital for surgery, they find they have diabetes. And that's what we mostly see in type 2. People don't go to the doctor with those other complaints. They show up, the doctor says, oh, by the way, I have diabetes. The person says, I can't believe it. And they really have trouble believing it at the beginning because they have no symptoms.
And when you get diabetes, whether it's type 1 or type 2, how do you treat it?
Healthy lifestyle is far and away the most common thing that we emphasize. Now, medications are crucial, and we can talk about medications, but if you don't have the backbone of good diet and good exercise, the medications just don't work as well. So we talk mostly at the beginning about diet and exercise as being the key components.
When you're talking about diet, okay, what does that mean? Because is it the same as with heart disease? More fruits and vegetables, or are there specific foods that you should eat in order to prevent diabetes?
We've seen an amazing change in the recommendation for food during my 30 years of practice. We all know this in society. We talk about the high carb and the low carb and the high fat and the low fat. And we've really gone back in this day and age to low carb diets. They were popular, and then they became unpopular. But right now, I think we're all pretty clear that people need to restrict their carbohydrates. And what I mean by that, I mean the starchy carbohydrates. I mean the pastas, the bread, the potatoes, the chips, those types of things really need to be reduced in quantity. Emphasis, though, should be placed on the good carbs, fruits and vegetables, as you just said. Those are the things we should be emphasizing.
This is fantastic advice. Thanks so much for joining us, Dr. Silver. Thanks for joining us today for Health Perspective. For more information on diabetes,
What about symptoms and signs? So it was very interesting. Let's continue. And the last video is a testimony of a young lady who had diabetes type 2.
Ashley Crossman here, and I just got done reading an ebook that tells you all about how to reverse diabetes in 21 days naturally. I took a couple points, there's about 7 of them I want to read through for you. You will learn the cause and how to prevent diseases, many major diseases like kidney disease, cancer, hypertension, obesity, heart attack, stroke, and much more. You'll also learn about a secret breathing exercise that if you do 3 times a day for 10 days, your energy will increase dramatically. You'll have lifestyle, food recommendations, and a whole list of foods to avoid is included in the ebook. There's also a secret drink recipe that has significant changes for your body, and here's the numbers for that. If your blood sugar is over 400, or one of the ones where you have under 60 blood sugar, 90% of the people who drink this reduce their insulin need by 50%. So it doesn't matter if you have high blood sugar or low blood sugar, the secret drink recipe will really help you out, especially if you're insulin dependent. It also will tell you about why diabetes drugs can be keeping your diabetes worse and damaging your health. You'll also learn the shocking health truths that most people don't know about drugs and chemicals from the companies and the pharmaceuticals that are used every day and the dangers that are included with those. And last but not least, it'll list 3 poisons that you must eliminate if you want to truly be healthy. It's very important to know these things if you're trying to be healthy, and the book totes that within 21 days you will reverse some of your diabetes and it'll be 100% natural. I read the book. I'm definitely going to try some of the diet tips and stuff, and I suggest that you guys click the link below and take the 7-day trial for only $7. And if you like it and you continue using it after 7 days, you'll be charged the rest of the price, $40. But there's 60 days, and there's a 60-day guarantee for you to return the book if you're not happy. So it's really easy. Click the link below, $7, give it a try for 7 days. You're not going to lose anything. If you're unhappy, you can get your money back 100%, no problem.
So, thank you very much for watching, and see you next time.